Hello, I'm Dr. Priya Matthew at MVP Family Dental, and today I'm going to answer some of your questions about cosmetic dentistry. Cosmetic dentistry is where we use our dental tools to improve the cosmetics of your teeth, so we help your teeth and smile to look better. You would know if cosmetic dentistry was right for you or your family if you or your family member don't smile in public, don't want to smile in public or cover their mouth, or just in general feel self-conscious about their smile. If there's anything that bothers you about your smile, that would probably mean that you could benefit from cosmetic dentistry. Cosmetic dentistry and general dentistry do overlap in some ways. General dentistry is more bread and butter dentistry, so you could say fillings, cavities, cleanings, crowns, things like that. Whereas cosmetic dentistry could include such items as veneers, anterior crowns in the front, or full mouth reconstruction. It could include replacing teeth that are missing, and anything to generally make your teeth look better. It could include whitening of the teeth and straightening of the teeth. Cosmetic dentistry and restorative dentistry could overlap. For instance, if you had a tooth that was broken in the front and you also wanted to fix or improve the condition of the teeth around it, we would do veneers or crowns in the front. That would be cosmetic dentistry. Whereas restorative dentistry is the restoring of that tooth that broke. So basically, you're putting it back together. You're making it whole again. A cosmetic dentist can use several ways to fix your teeth. In the front area, if you're unhappy with your smile, they can fix a gummy smile. We can fix the shape and size and color of the teeth in various ways using veneers or using crowns or whitening or even using composite fillings. We can fill in spaces. We can do a lot of things with dentistry, cosmetics in this day and age. Cosmetic dentistry can certainly improve your smile. That's pretty much the point of cosmetic dentistry. You could think of it as, you get cosmetic surgery so that you could look better. You get a facelift because you want to look more youthful. It's similar with teeth. Say you have very worn down teeth that you've just been grinding on for a long time. They're very short. We can restore them and bring them back to their healthier size that you had probably, when you were starting out in your 20s. If you're older now and they've worn down, we can make them back to what they were, but in a natural way for whatever age you are. Cosmetic dentistry may be able to fix an overbite. It really depends on how much overbite there is and what is causing the overbite, such as, is it because of where your jaw is located, like a skeletal overbite, or is it just where the position of the teeth in the jaw is located, which is a little bit easier to fix with orthodontics. So we do Invisalign and braces. Those could fix an overbite if it's slight. If it's more involved, we might be able to refer you to an orthodontist who could help you to fix the overbite. Cosmetic dentists can fix crooked teeth either by straightening them with something like Invisalign or traditional braces, or you can use crowns and veneers to make the illusion that teeth are straighter than they were. A cosmetic dentist could work with younger children, but depending on what is going on with the young child, we may need to refer to a pedodontist or a children's dentist. We can do bonding and certain things to make teeth look better depending on the age of the child. A child can come in to get evaluated for cosmetic dentistry. If the child is old enough to start braces, we can start that. It really depends on how far along developmentally the child is. There is no point at which a person would be too old to get cosmetic dentistry. I've done cosmetic dentistry on 90-year-olds, 100-year-olds, so there's no age limit on that. If somebody is not in good health, there could be some limitations, but we can always look into it, bring the patient in for a consult, take a look at what's needed, and if it's not invasive what's needed, then we can certainly do that. Cosmetic dentistry can fix a lot of issues in the front of your mouth. Cosmetic meaning people see your smile. So If you have spaces in the front of your mouth between the teeth and you want to get them closed, we can do that in various ways. If you don't like the shape or the color of your teeth, we can change that in various ways. If you just don't like how they look in any way, there's many ways that we can fix that. Even if you have a gummy smile, like your smile is just, you see a lot of gums, we can fix that. Cosmetic dentistry can change the structure of your mouth by providing structure where maybe there wasn't structure before. For instance, if you're missing teeth in the back and you get teeth in the back, then you'll have a little bit more support for your overlying cheek area or your lip. There definitely is more lip support, and it overall can restore the functionality of your teeth. So if you have worn down teeth and you needed to build them back up, we could do that as a form of cosmetic dentistry. Cosmetic dentistry is considered oral surgery if you do not have teeth and you need to get implants placed, or say you have some teeth that need to be removed. Those are all falling under oral surgery. The advantages and benefits of cosmetic dentistry are that you can leave feeling more confident and wanting to smile more, which then leads to you being happier, because there is research out there that says if you smile more, you actually become happier. So your whole life can improve and change just from improving your smile. The process you can expect to go through is, first we start with a consult, see what you would like to do, what you would like to fix and change. We take some photos, we can do a simulation to show you how you would look after the cosmetic is done, just a rough idea. And then we set up an appointment. We get our records if needed beforehand, so maybe some impressions or scans of your teeth, like intraoral scans that are done digitally. And then you come in for your appointment, we numb you, we do our thing, we prepare the teeth for whatever cosmetic procedure we're planning, and then we take our impressions or our scans, and you leave with the temporaries. And then once your permanents are in, we have you come in 2 to 3 weeks, and we deliver those permanent restorations. So whether they be crowns or veneers or dentures or what have you. When you're considering a dentist for cosmetic dentistry, you should consider how their cases have come out. So you would maybe want to look at their before and after photos of patients that they've done. I would check reviews to see how they are in real life. And yeah, cosmetic dentistry is not painful. You are completely numb when we do the procedure. We make sure you're comfortable and you're always in control. So if you need anything, you raise your hand, we stop right away. It is not painful. We use local anesthesia at our office for cosmetic dentistry procedures, and we use a numbing gel before we do our injections so that you're a little bit more comfortable. It should not take very long to recover from cosmetic dental procedures. Again, it depends what you're getting. I mean, if there's some oral surgery involved, like extractions, yeah, that might take a little bit longer to heal from. But if you're doing restorative work, such as bonding with composites or crowns or veneers, you really shouldn't have any downtime with that. You would need to follow some directions after cosmetic dentistry. For instance, if you're leaving with temporary crowns or temporary veneers, you would be instructed to not have very sticky or hard foods for the next few weeks until you get your permanent veneers or crowns in, because we don't want to break the temporaries. But that's pretty much it. Cosmetic dentistry usually is not covered by insurance. However, if you have a lot of severe crowding of your teeth in the front, then there is orthodontic coverage at times. It all depends on your insurance carrier, but we do take a look at that and let you know before we start the treatment. There are several financing options available to help you cover the cost of your cosmetic dentistry. We have Cherry as a financing option, which does offer 12 months 0% interest if you apply and are approved, but we can walk you through all those options when you're in the office. You can call MVP Family Dental at 215-887-7171 to make your appointment for a cosmetic consult. You can also reach us at our website, which is mvpfd.com, and follow us on our social media at MVP Family Dental.